So I'm going to talk into my computer and say welcome to, hopefully, fingers crossed, for some people who've tuned in to listen to the School of Medicine Open Day talk. My name is Rob Jarvis. I'm one of the tutors. I'm a GP by background. I'm one of the tutors in the medical school. I've been working here for about 18 years or so, having a really good time, different bits of the medical school, and I now lead the student support bit of the course. So if you do end up with us, then you may well come and see me at some point. I'm sure you'll get to know us. So we've got a few colleagues. There's some students here today. My colleague for admissions is Dr. Michael Murphy. He's going to be talking about admissions in a short while. And then I've got a range of different colleagues behind the scenes who are here to answer your questions that you might want to put into the chat. I would suggest that maybe you want to just be a little bit careful about your questions to start with, because some of the things that we're going to talk about might answer some of those basic questions. So you might want to just hang on for a little while. The structure we're going to try and run. I'm going to talk to a few of our current students for a quarter of an hour, just ask them about the course, and it'll give you a bit of a heads up about what we do here in Dundee. And then Michael's going to talk about admissions for about the same amount of time, and then the rest of the time we're going to have for open question and answer session. So I'm going to start off when I come to each of the students. So I've got 4 or 5 students here with me today. There's a couple of 5th years, couple of one of our 4th years, and a couple of our students who are doing an intercalated BMSc. It's a bachelor's in medical sciences that they do in between years 3 and 4. So they've joined us today to answer some of our questions. So thank you very much to them for actually joining. So I'm going to start off by introducing Finley. Finley, are you there? Do you want to turn your camera on? There's his lovely mug. Right, everybody say hello to Finley. Finley, say hello. So what are you doing at the moment, Finley?
So I'm currently in 4th year. I've just finished a BMSc year in anatomy, so back into medicine now.
That's fantastic. And I was going to ask you, can you just briefly for us just outline sort of the structure of the medicine course here in Dundee? How does it work?
Yeah, so it's going to split into 2 sections, I guess, as it were. So we've got SIP, Systems in Practice, and PIP. I can't actually remember what it's.
Preparation in Practice.
Preparation, that's it, thank you.
That's
I can never
remember
that first P. So SIP is 3 years, PIP is 2 years, and they're separated by intercalated. You don't have to do that. Lots of people do. It's quite good, but you don't have to. So SIP is broken up into basically systems blocks. So you'll start off with 8 weeks or 2 months going over all the basic sciences. That's kind of learning how drugs interact, all the basic anatomy, all of this stuff. So you've got a good basis to work from. And then after that, you go into all the different systems. So start with respiratory, you'll go through all the basics of RESP and then cardio, and kind of work your way through those 3 years. So you learn all the kind of theoretical basis and also kind of the basis of all the clinical skills you'll need. And also you get to practice them. And then so you don't just kind of learn it. So say RESP is the first block of 1st year. You don't just learn RESP then and then forget about it until you become an actual doctor. You learn the basics and then you'll come back to it later on, recap it, and then build on it, kind of learning more, whether it's more kind of specific RESP teaching or get crossover from other blocks as well. That's the same throughout everything. So we'll probably hear a bit more about it. It's called the spiral curriculum. So it's kind of constantly building, and it's a really good way to do it. So you don't just forget stuff from 1st year, but you're actually using it. Then once you get into the PIP years, so I've just started 4th year, so 1st year of PIP, you're more kind of applying what you've learned in the last 3 years. So you are still learning, kind of getting more clinical experience. You're kind of learning more about how to clinically deal with things rather than the theory behind them, but also you need to kind of remember the theory so you can apply this clinical ability. So you've basically got 2 years of that, and final exams are actually at the end of 4th year. So 5th year is pretty well just clinical, just kind of getting everything down so you know what's going on. So I think that's me.
That's fantastic, Finlay. That's given us a good insight into it. I'm gonna do, because we've not got huge amounts of time, I'm going to sort of move on and actually build on it a little bit. Fiona, I don't know whether you're there. Do you want to join in? Turn your camera on. Hello, Fiona. Do you want to introduce yourself just to start with? Tell people where you're at and what you're doing.
Hi, so I'm Fiona. I'm a 5th year medical student currently on placement in Kirkcaldy.
And what are you doing in Kirkcaldy?
My foundation assistantship, so learning the job.
So what does that actually mean? Maybe you could tell people what that actually is.
Yeah, so your foundation assistantship is an 8-week block that you do in your final year of your studies, where you're basically shadowing the sort of junior doctors and learning more about what their role is and what you're going to be doing sort of in a year's time, learning how to do all the odd jobs and all the admin and things as well. So yeah, it's a really, really useful block to do.
So that reinforces the sort of the really quite practical final year of the course, actually trying to set you up for the job that you're doing. As yes. Nitya as well has joined us. Thank you very much, Nitya, for joining us. Nitya, do you want to say who you are and where you come from? No, that was a joke. That was a reference back to a long time ago. But anyway, Nitya, tell us about yourself. You're 5th year as well, aren't you?
Yes. Can you hear me okay?
Yes, that would be great.
Perfect. So, hi, I'm Nitya. I'm a current 5th year medical student. To answer Rob's question, I'm originally from India. I grew up in Abu Dhabi and then I moved to Dundee just for my university. So I'm one of those international hybrid kids, as you might say.
Okay, so, fantastic. And what are you doing in 5th year at the moment?
So I'm currently doing my SSc in radiology. So it's one of the student selected components, what it technically means, and it's something that carries on throughout year 1 through to year 5, and it's when you can either choose an SSc that a project which is already pre-assigned, or it's something that you can choose by yourself if you find a supervisor, and if there's a particular topic that you like a lot, that you think, I really want to do this, and you can just approach a supervisor and kind of do a project in it. So I'm currently doing mine in radiology, and it's been a lot of fun.
Okay, so that's a nice illustration. Nice to see the enthusiasm coming through. That's always good. But a nice illustration of the fact that it's setting you up for sort of the job, but also it's got these options that happen throughout final year. We get options through the rest of the course as well, don't you? I was just going to ask the two of you, maybe. Nitya, can I start with you? What sorts of methods of teaching do we use here in Dundee? What sort of different methods of a new student, what might they expect maybe at the start and then later on?
So I think the biggest transition when you come from school to university is that the lecture size, so the number of students you're going to attend a lecture with is going to be huge. So especially in year 1, you have about 160 plus students going to be sitting in one lecture theatre, and you have a lot of teaching sessions which are given by your lecturers, which could be doctors or professors, and they kind of teach you the basics, especially in years 1 to 3, as Finlay mentioned, the systems in practice, where you have more of a theoretical based teaching which is happening. And so if you, for instance, for a first year, let's go with that, on a Monday to Friday week, you have maybe the first 3 days you have a lot of teaching in the lecture theatres. And then on Thursday and Friday, what you have is more of an application-based teaching, where you have small group sessions where the content that you were taught in the first 3 days of the week is kind of quizzed on, / you have a lot of material and worksheets and questionnaires that you can kind of work through, and they're then discussed with your group. So again, and when you come to join med school, you have your entire year's cohort is divided into 4 subgroups like A, B, C, D, and A is further divided. All the subgroups are further divided into another 4 subgroups like A1, A2, A3, A4, and you get your small group teaching sessions with your subgroups, so A1 or A2, or maybe with the whole of the group A, but you have all your lectures with your entire year cohort. Now, because of COVID, they could be online, especially the full year lecture theatre sessions. But again, things are changing now, so it's a bit of a blended learning situation at the moment. But when you move on to 4th year and 5th year, it's predominantly ward-based teaching, because especially last year for us, you have a lot of refresher sessions on topics that were taught, especially in 1st year, and then you keep coming back to these topics again throughout the 5 years of your medical school. But 4th year is kind of when you get everything together, because you're on placements, so you have 10 blocks throughout the year. And when you go on placements, maybe, for instance, if you're doing a placement in gynecology, for instance, you're on the wards, you're at the clinics, you see a lot of patients, you kind of apply your knowledge from before, but at the same time, you do have a few lectures here and there from your clinicians who have taught you the same content in year 3, for instance, with gynecology. So you have a few refresher sessions as well. So it's not like you're not being taught anything, but it's a mixture of you get to see things at the clinics, you get to do things by yourself, but at the same time, you have refresher topics which kind of help to consolidate the knowledge that you already know and kind of fill in the gaps that if they are present. So I think that's how it kind of progresses from year 1 to year 3, where it's more of theory-based and more of workshop-based, group-based learning, and then you come to year 4 and year 5, where it's more practical. You're on the wards, you're on the clinics, and you apply your knowledge.
Excellent, excellent. Fiona, I'm going to just come to you for a sec, and that sounds like it's very clinical towards the end, but how much clinical do you actually get at the beginning of the course?
So this was one of the things that actually drew me to Dundee as a medical school, is that you do get very early clinical exposure. So even in first year, you do have scheduled sessions on the wards for teaching, where often a consultant will take you around and do bedside teaching, or you'll be asked to examine patients and present them back to the consultants and practice the skills that you've learned in clinical skills. There's also the opportunity, there's some coursework with our course, not a huge amount, especially compared to other courses, but you have to go onto the wards and perform a clerking, so take a patient history, examine the patient and write it up, and then that's assessed. So you are encouraged to, go onto the wards and get this experience. There's also normally every week in first to third year, you would have a clinical skills session where you practice your examination skills, and that really prepares you for going onto the ward and doing these history and examinations.
Excellent. So it's been a bit disrupted this last 18 months because of COVID, we know, but the normal practice is that we try and introduce these things at a really early stage and then build it up. So it just becomes more and more as you get through the years, isn't it? Okay, that's fantastic. Nitya, thank you ever so much. Fiona, I'm going to ask you to hang on just a minute. And Sophie Merritt, are you there? Can you join us? So Sophie, do you want to say hello? Do you want to say hello and just give people a brief bio, where you're from, what you're doing?
Yeah, of course. So my name's Sophie, and I've just completed my 3rd year of medical school, and I'm starting an intercalated degree in medical education. And where I'm from, so I'm from Lanark, so just south of Glasgow. It's very small, probably no one's heard of it. And then I've obviously been at Dundee for 3 years now. Apparently my
great-grandmother came from Lanark as well.
Oh, there you go.
Doesn't sound like it from my voice, does it? Anyway. So you two, the challenge I'm going to ask you is, so what's life like? What's life like in Dundee? What's life like as a medical student here? Sophie, do you want to go first? Do you want to?
Yeah, I can start. I think that it's such a hard one to sum up because there's so many things that kind of encompass life as a medical student and life at Dundee. But there's a couple of things that I thought would be good to highlight. So first of all, I've had an amazing experience at Dundee so far. It's obviously been quite different the past kind of 18 months. But even so, it's still been great. And I think one of the highlights for me, and again, something that drew me to Dundee, was the kind of sense of community that there was. Like when I attended the open day, I felt as if there was a really sense of community between the staff and between the students. And I think that that's kind of enhanced at the fact that we are based at Ninewells pretty much all the time, with only a few exceptions. And that really means that you do get a chance to get to know the staff really well, get to know your own year group, and also get to know older students. So I have a lot of friends in older years, and it's really helpful to sometimes say, oh, I'm not too sure about this, can you help? Or even, where's this lecture theatre, or where's clinical skills, can you help me get there? And another kind of big thing is the fact that there's always the med school office staff who are there, and they're always kind of a friendly face, whether it be, again, I don't know where I'm going, can you help me find it? Or, just a friendly face after a tough day of lectures. It's nice to sometimes go along and have a little chat with them. One of my favourite things about studying... I'm just going to jump in for a second. You mentioned Ninewells. Want to clarify, everybody knows that Ninewells is the big teaching hospital here in Dundee. Yeah. and what you're saying basically is the medical school is actually based in Ninewells, isn't it? So so we're actually co-located on the same site. We're a relatively small medical school, and actually we have lots of the clinicians who come along and do teaching there. So it does help with that sense of community, doesn't it? Yeah. Definitely.
And I'm sorry I interrupted you. You carry on.
No, you're okay. Just my last point was on Ninewells as well. So it was actually just the fact that we get that early clinical experience that Fiona was talking about, really early on, but we're also based kind of on the wards. We get that clinical experience there as well. So although we have an immense clinical skills department where we're kind of taught by different tutors from different specialties and GPs and things, and we practice our clinical examinations, our communication skills, both on other medical students and on simulated patients. So these are patients who come in, they are volunteers from the community. They're maybe kind of ex-doctors and nurses and things, and sometimes we get actors, and they really enhance our experience of being able to practice these things. And then we can take that onto the wards, because we are, you know, based at Nine Wells Hospital, and that allows us to go on and practice those things with patients as well, which is an amazing opportunity that, you know, really drew me to Dundee, because it allows you to kind of link those lectures and tutorials that you're learning and then put them into practice, either kind of in clinical skills or on the wards.
Thanks, Sophie. Fiona, I'm very conscious that we need to be moving on time-wise. Any things that you want to add just from that sort of life as a medical student perspective?
Yeah, I think I agree with Sophie. There is a great sense of community in the medical school, especially between different years. And I think a lot of that's then down to how active the different medical school societies are. Whatever you're interested in, there are so many different societies, from Teddy Bear Hospital that get sort of kids up to the hospital and teaches them, you know, what happens up there, as well as things like DECS, the Emergency and Critical Care Society, who arrange different events all throughout the year. I'm also a massive preacher of, like, what you do outside of medicine is just important as what you do in medicine, and like your timetable really allows you plenty of sort of downtime to join university sports teams, to join societies outside of medicine, and some of my best medic friends I've made on university sports teams, not actually through medical school at all. So there's still that huge sense of community. So yeah, I think that is the main sort of takeaway message.
Fantastic. Thank you very much. Two of you stay on, and Dom, could you join us as well? So just want to introduce you to Dominic Lee. Hello, Dom. Your moustache is looking wonderful today. Just introduce yourself, Dom. What are you doing at the moment?
Hi, so I'm Dominic, or Dom. I've just finished my third year. I'm going on to my integrated degree in applied orthopedic technology. I will one day get through the entire title without stumbling. And I'm also the School of Medicine student president for the next year.
Fantastic. Well, thank you very much for joining us. And I know you've got a bit of an interest in this next question I'm going to ask you, and that's about, you know, what advice would you give a newbie who was joining Dundee Medical School?
So I think the first thing I would say, which is probably the most important thing for medical school anywhere, is there's more to the university than the medical school. So when you are picking a school, when you've just arrived, look around the school in other ways. You're going to have to spend 5 or 6 years living in the city where you are going to medical school. So get to know the place, find things you enjoy, find nice places to eat and whatever, and just enjoy the place you're at. Medicine is amazing, and like, I love it, and I know everyone who studies with me, we all love what we're doing, but there has to be another part to your life. And that kind of leads on to my second thing I would say, which is join a society, join a sports club. There are like 50 sports clubs and 200 something societies, and there's more every year. You will find something you enjoy. If you don't enjoy any of the societies or any of the sports clubs, I don't believe that. So find something you enjoy and just go for it. University is a time for trying things, for learning, for growing. I sound like my mum, but no. Find something you enjoy doing, sign up and just go for it. You don't have to be good at it. No one cares. As long as you're having fun, that's great. I think the last thing I would say for new students is we all come into medicine being the best of our year, the best applicants, because it's really competitive to get in. As soon as you get in, no one cares anymore. Don't try and, if you want to do well and you want to get top grades, of course, go for it. Try your best, but don't get bogged down, because some things aren't going to go as well. There's going to be bad tests. There's going to be an essay. You get the title and go, cool, don't understand the title. Great start to this. And that's fine. Work together and just accept that it's going to be difficult, and it's difficult for everyone, and that's okay.
That's great advice, actually. I have a real bugbear about this whole, everybody who gets into medicine is pretty clever. And then they all get here, and then suddenly they're not top of the class anymore, apart from 1 or 2 really annoying people. So and everyone has to get used to it. I had to get used to it when I did medicine. You guys have all probably got used to it, apart from maybe one or two of you who are really annoying. So I'm going to stop it there and actually I might come back and ask you other advice about what advice you have for newcomers. But I just wonder now, I should pass on to Michael. Do you want to join in and then just give everybody a bit of an update regarding admissions?
Yes, okay, thanks for that. And thanks everyone for your contributions so far. So my name is Michael Murphy, and I have a couple of roles in the medical school. One is the admissions lead, and secondly, you've heard already about student selected components, and I'm the SSC lead as well. And this bit of the session is really just designed to update you and hopefully just reassure you about the way that we select people for medical school. So I'm just going to first of all try to share my slides. Hold on a wee second. I should also say perhaps my postgraduate specialty is clinical biochemistry, so that's one of the lab disciplines. So essentially it's mostly to do with the processing and interpretation of the blood tests that patients have done in hospital and in primary care. So I think I'm sharing my slides, and if I'm not, maybe I might ask one of my colleagues just to confirm.
It looks fine.
Sharing them.
That's helpful. Thank you for that. So I'm going to try to stick fairly strictly to a 15-minute slot, just in the interests of allowing the others to continue the conversation, because I think that from your perspective as applicants is actually a lot more useful than somebody just going on about different things. So anyway, just going to try to advance my slides. Okay. Okay, I always include a slide on rankings, really not to labour the point, but just it is important for you as applicants to know that you're applying to a highly regarded course. And I think actually that Fiona and Dom have made the point very well, that there's more to studying at university than just the course that you're doing. I think they've made the point better than I could. And it is important to feel that you're choosing a place where you are likely to just enjoy being a student. And as I say, in terms of the shorthand for that, is probably the best is probably where we sit in the National Student Survey, and again we're within the top 10 usually in a cohort of about several hundred universities and higher level educational institutions. So I won't, as I say, labour the point. I'm happy to come back to that if we want to in due course. So as I say, the purpose of this bit of this slot is to really just take you through our selection process and confirm that we haven't basically changed anything except insofar as COVID has forced us to. So the basic selection tools are as they have been for many years. There's the academic score, which is based on your school grades, or if you're a graduate applicant, on your university grades. There's the UCAT score, UCAT being, as you know, the aptitude test that we and lots of other medical schools use to help us to select students or applicants for our schools. And depending on how you do in the combination of your academic and UCAT scores, you may get invited to interview. And we interview, as you may know, in a particular way, the multiple mini interview, or MMI. And again, that's not just us who does that. There's lots of medical schools who interview in that way, and we can talk about the reason for using that particular format if you want later on in the conversation. And depending on how you do relative to other people in that MMI interview, you may or may not get an offer, basically. And essentially, whether or not we make you an offer depends exclusively on how you've done relative to others in the MMI interview. The academic score and the UCAT score have served their purpose if they've got you to interview. And underneath the selection tools, I've basically included for information the approximate numbers last year who applied, who were interviewed, and the number of places that they were competing for. And on the basis of that, you might get a bit depressed because it looks like as though there's a 10-to-1 ratio or worse in terms of applicants to places. But of course, you're all applying for more than one medical school, and actually most of you stand a chance of 40 to 50% of getting into a medical school, so it's not as bad as that. So straight away to our minimum academic requirements. They are essentially unchanged from previously: 4 A's and B at Scottish Higher, 3 predicted A's at A-level, or 37 points in the International Baccalaureate exam. If you're a graduate applicant, it's a 2-1 or better. Because the courses are so competitive to get into, we don't accept the results of resits, and the expectation is that exams will have been done in one sitting. Obviously, COVID had a major impact on that last year, and as I say, but in a normal year, that would be the expectation. In terms of subject requirements, again, unchanged. We still require chemistry and 1 other science, and that other science can be either biology or physics or maths. So if you have chemistry and one of those 3, then you have met our subject requirements, and we do not have a view on your further subject choices. Lots of people ask, should I do all 3 sciences? And actually the answer to that is if you've got met our subject requirements, do the subjects that you think you're going to do best in. So for those people who aren't offering biology at Higher or A-level or IB, then we would require an A in biology at the Nat 5 or equivalent, or GC or equivalent basically, and likewise we would require maths and English to those grades B as well. But if you're offering those subjects to a more advanced level, then that doesn't apply. I usually say something a little bit about widening access because that's very important to us as an institution, the University of Dundee, and as a medical school. So this slide, the y-axis on this slide essentially shows the percentage of students or pupils from a school progressing to 3rd level education. So if you're a student or a pupil at one of the schools on the left-hand side of this figure, you're basically in a class where most people are aiming to get to university. So if you're wanting to do medicine or dentistry or another high tariff course, there's a very good chance that you'll be one of several, and sometimes one of quite a few people who want to do that. So the point I'm making really is that the school is likely to offer all of the subjects that you need to the level that you need, and to provide you with lots of support and help in your application. So if you're on the other side of this slide, you're at a school where maybe only 10 or 15% of pupils want to apply to 3rd level education. And if you want to do medicine, there's a very good chance that you'll be the only one, or one of maybe just a couple who want to do medicine. So it's quite likely that the school won't offer all of the subjects that you need to the requisite level. And essentially the point I'm making is that the barriers to your successful competitive application are much greater than they are for somebody in the first category that I spoke about. And the big blue arrow essentially shows the Scottish average. It's between 35 and 40%. So we're keen to try to smooth the path a little bit for people who don't have the same opportunity as other applicants. So we lower our minimum requirements for widening access applicants. And so it's 3 A's and 2 B's. Some schools only allow you to sit 4 hires at one session, and if that's the case, then we will accept or consider a 3 A's and a B. And likewise for predicted grades at A level, it's an A and 2 B's. And there's contextual adjustment of the UCAT and MMI scores, and that means basically adding 10% to your score. And the 2 orange or yellow arrows are pointing, if you're wondering whether you meet the criteria to be a widening access applicant, then just visit this website, the University of Dundee webpage, and essentially you will be able to find out whether you are or not, or whether you do or not. And if you're still not sure after visiting that webpage, please feel free to contact us and we'll be happy to work out for you whether you would or not. So if you think that in fact you don't stand a chance of even meeting the reduced requirements, and that may be through no fault of your own, it may just be that the school that you're at doesn't permit that, or other circumstances may form a barrier to you mounting a competitive application We and quite a few other medical schools offer a gateway to medicine year. So essentially it's an additional year which acts as a bridge from school to the medical course proper. And the widening access applicant for that would only require 5 Bs at higher, or an A and 3 Bs if your school only allows you to do 4. Same subject requirements, chemistry and 1 other science, and again contextual adjustment of UCAT and MMI scores. We do have a separate category of applicants called non-science. These are usually people who've decided, perhaps on their way through university, that they wanted to do medicine. And so it's usually only a handful of people who are interested in that option. But we do provide a route into medicine for those people as well, and they share that year, the gateway to medicine year, with the widening access applicants. But as I say, they account for a much smaller percentage of the people on the course. And again, just to make the point that we in the Dundee Medical School, we don't just pay lip service to widening access. So, for example, Sophie, who's in the meeting, she's co-president of a student society called DWAMS, the Dundee Widening Access Medical Student Society, which was set up a couple of years back, and I'm sure she'll be happy to talk about that. And we also have John Lucharski, who's on the call as well, and has a wealth of experience in widening access. So if any of you have specific queries that you'd like about that, I'm sure they'll be happy to help address those. So as I say, the Gateway Year is very well supported. There's lots of pastoral support as well as academic support, and it provides the same kind of teaching as you get in the medical course proper. So you, as a Gateway student, you get exposed to the kind of teaching that you'll be getting in medicine. So I'm guessing that most of you will either already have done your UCAT, or if not, you'll have registered for it by this stage. If you haven't, I recommend that you do so fairly soon, because as you can see, it's not that long to the closing of registration, and it's not a good idea to leave it to the very end, simply because you might find on the day that you're not feeling great or whatever, and it makes sense to book it, to give yourself enough time potentially to reorganize if you have to. But as I say, I suspect you'll be more familiar with the key dates than I am. Anyway, we're happy to talk about that if we need to subsequently. We always get loads of questions in these sessions about what's the lowest UCAT score that we accept, and it doesn't work like that here. We basically use UCAT deciles of performance, and in fact UCAT quite helpfully provides the deciles for each year. So these are the ones from last year, and essentially I've having researched this and looked through the deciles for previous years as well, I can tell you that there's little or no evidence of UCAT score inflation over the years. So essentially the average score is around the 2,500 mark, and we do not use a UCAT threshold. We essentially divide UCAT scores into deciles of performance, and they contribute to your UCAT score. That contributes to how we decide to select people for interview. So a word about interview. Because of COVID, we held the MMI interviews remotely in the last academic year, and we did try to retain what I might describe as the MMI philosophy. So we continue to use MMI stations in the same way as we have in previous years. In terms of the way it all worked, I think the way I would summarize it is to say it mostly worked quite well. As you might expect, there were internet issues on a regular basis, and they continued throughout the 4 or 5 weeks that we interviewed, and but we all basically got more used to dealing with them and got quite slick at handling it. So, you know, we're doing it exactly the same way this year. And so, as I say, the experience of the platform and of dealing with the technical issues will hopefully stand us in good stead this year. Work experience is something that exercises everybody, even in a normal year, and precisely because COVID has stopped most people from getting conventional work experience, that has exercised people as well. So I think you perhaps forget that we as a medical school are acutely aware of the fact that most people won't have had the same ability to gain relevant work experience, and we're quite happy to accept other evidence of your commitment to study medicine. And if you haven't seen these virtual work experience things, then I'm just bringing them to your attention just now. The web link at the top of the page essentially contains access to these different bits of information and different courses that you can do. And you know, if you haven't had a look at that, then I recommend that you do. But most people will probably have that. And as I say, don't feel that your application is not going to succeed just because you haven't got work experience. It doesn't work like that. It's your, you know, people have other ways of conveying their commitment, their passion for medicine. And actually, we again have very DWAMS and Medic Insight are two local student societies. So you've heard about those already, and these are just two of them. And I've included the hashtag, the handles to them underneath, just because it's not immediately obvious from the screenshots. And if you want to be kept updated on the events that these student societies organise, then I suggest that you follow them, because that's the best way to keep in touch. And between the Medic Insight and Widening Access DWAMS, they provide fantastic liaison on behalf of us, I guess, to provide you with opportunities to, as I say, just to engage with us as a medical school, to gain some kind of handle on what it's like being a medical student in Dundee. So, as I say, I'm sure there'll be questions about that, and I'm sure that my colleagues will have things to say about that. Just one final substantive slide on the personal statement. We read your statement on receipt. We don't rank it then, but if we invite you to interview, you will be asked about it. There is a personal statement station, and you'll be then marked on what you have to say about it. And that's really all I have to say about personal statements. And I have other slides which these are all pictures of our medical students on the course. And you've heard, or hopefully already had, a sense of the fact that we're a friendly medical school and that we're a practical medical school. And I would just add that I also think Dundee is a very innovative place to work. But I'm not going to say anything more about those just now. I'm going to reopen the meeting for a chat, basically. I'm going to stop sharing my slides just now. So thank you very much.
That's great, Michael. Thank you very much. So Michael, you're going to stay on. I presume you'll keep your camera on. I wonder if the other students who are on the call might want to turn their cameras on as well. And we do have quite a lot of other people sort of background who have been trying to answer any questions that you might have been posing with us already. But I wonder if we could ask them, could I be guided by those people who've been looking at the questions as to whether there are queries that are coming in, and maybe you could actually ask them to us sort of verbally, and then hopefully we'll be able to respond. Would that be possible?
Yes, I think a lot of them that we've got so far have been answered in Dr. Murphy's presentation, but let's just have a scroll through and see what we've got.
That's great, Finlay.
Is there a cap on the number of English students that can be accepted, and are Scottish applicants more likely to get a place?
So all the medical schools in Scotland have a cap, and that's dictated by the Scottish government. But the answer to the second part of the question is no, not in. So basically, in every year, the RUK students, what we call rest of UK students, they're not competing with the Scottish students. They're competing with each other. The different student groups, or the different applicant groups rather, are divided into their. You're only competing with the people who are in the same group effectively as yourself.
I just saw a question came in that I thought was quite interesting. Sorry, Dom, I'm going to jump in about exams. And I don't think that's something that we really covered at all, was it? So I wonder whether one of the students actually wants to tell us about what in your experience of the assessments and what they're like and how lovely they are.
Yeah, I don't mind
Go on,
taking that
Sophie.
one. Yeah, so the assessments have been slightly different the past couple of years because of obviously COVID and things, but I'll just tell you a little bit about what they were like before that, because I'm sure we'll get back to that. And basically our assessments throughout the year are more formative. So a formative assessment would be classed as, you know, it kind of doesn't matter how you do in it, it's more for you to assess yourself, so for you to see how you're getting on with the course. And we do those assessments kind of throughout the year, there's a couple. And then at the end of the year, in kind of May time, there's a week of assessments, which is joyful. And basically we have a full week of assessments, so that's the full 5 days, and we have 3 online exams and we have 2 OSCEs. We also have an anatomy spot test, which is basically where they'll kind of put pins in different anatomical parts and we have to kind of name them, which is extremely difficult, and definitely not something that I'm very good at. But our assessments are quite intense, but you can see the logic behind them and why we have to do them. And our OSCEs, I'll quickly explain what that is. So that's our practical assessments. So that's where we go around different stations, kind of similar to an MMI really, where you go around different stations and there'll maybe be a simulated patient who you have to do an assessment on, or who you have to communicate with, or you have to maybe do kind of an ECG, kind of a heart tracing, these sorts of things. And that's kind of how our exams work, certainly in 1st to 3rd year. And I believe it's the same in 4th year as well when you have your finals.
Fiona, do you want to just confirm that 4th year and 5th year, that sort of structure?
Yeah, so then in 4th and 5th year, we're quite lucky in Dundee. We sit our finals at the end of 4th year, and I didn't think a couple of months ago I'd be saying that was a lucky thing, but having been on placement just the past couple of weeks with students from different universities who sit their finals in their final year, they're still sort of stressing about learning everything for their exams, whereas I've done my exams, I passed them, I'm able to sort of really get stuck into learning how to actually be a doctor in a year's time, which has been great. So yeah, in 4th year you do your final online examinations and you have an OSCE, and then in your 5th year you have another OSCE just before you graduate, and then there's 2 assessments that everyone across the UK has to sit, so your prescribing safety assessment and your situational judgment test, and that's similar to, I don't know if they're still doing the SGT in the UK CAT, it's been a long time since I did it, but it's similar to that, and that sort of helps decide your ranking for getting your jobs. So we don't have any sort of big Dundee exams to worry about apart from our OSCE. We can sort of focus fully on learning the job and doing our SGT.
And I'm going to jump in and say you've also got portfolio to do as well, haven't you?
Oh,
So
yeah.
there is this sort of like constant sort of, you know, updating of experience and professionalism, and that gets assessed and make sure that you're up to a certain standard by the time you finish. Okay, that's brilliant. Other questions coming through? Finley, are you scanning, or is there anybody else that wants to pose us a question? Dom, you want to come in? Go on.
Hi Rob, yeah, I saw one earlier and it was what we're looking for in Dundee applicants, and I thought it might be nice if just as the students we say what we not look for, like in our peers and stuff, and things that we think about ourselves that have been helpful, or things maybe wish we developed before we got to med school, perhaps.
Go for it. Yep.
I think the biggest of all of them, well, at least to me, is resilience. I'm one of those really annoying people, and I guess I'm very both saying this. I had quite an easy time in high school. I did quite well without really working myself too hard. So when I got to medical school and things start getting a lot more difficult, a lot more quickly, I didn't deal with it as well as I could have done. I think accepting and knowing that things are going to be really hard, you're going to fail things occasionally, and how to get over that is more important than actually being good at the things in the first place, because you can always learn something. If you give it enough effort, you'll eventually learn it, except ECGs, which are nonsense and no one understands. No, you will eventually learn something, whereas if you're not able to get up and try again, you're never going to get anywhere. So I think the most important thing is just that ability to try it again and be resilient.
Okay, I like that. I think personal resilience is a really important thing, and it ties in with being satisfied and being good enough at a certain level. There's a lot of our students are really keen to be the best and feel as though they're a failure if they don't get A grades all the way through, and in perish the thought they fail an exam. It's the end of the world. Whereas actually in medicine, everybody recognises that standards are really high, and it's not uncommon to fail an exam. And I'm not going to ask Dr. Murphy how many exams he failed, but I've certainly failed one in my time, so I can put my hand up, and so's he. There we go. So you know, and so I totally agree with you, Dom. It sometimes takes a bit of getting used to that bit. What about other things, other advice that people have? What did they wish they knew before they came? Anything any of the other students want to? Go on, Nitya, go on.
Hi. So I think one thing that I'd like to add on is also the fact that you should try to be a bit more, put yourself out there, because especially when you're coming from a school environment where you don't have that many students, and, you know, maybe a class of 30 to where you come to a huge class of about 160 students, it can be very overwhelming. And especially at school, I was used to a very one-on-one kind of sessions, having one-on-one sessions with my teachers, and having more of a, I think, focused teaching style, especially at school. Whereas when you come to university, that's not how it is. And I think that's something that every student should be aware of, because I think that was very overwhelming for me. And then I think that put me off asking questions, asking doubts to lecturers, or just putting myself out there and doing things that I might have maybe done in a school environment. So I think it's just letting people know that, you know what, it's okay. No one's going to judge. Everyone's on the same page as you are. So everyone's equally scared. So don't worry too much about it. Ask questions. Don't worry about getting it wrong. There are no stupid questions or stupid answers. It's just, that's something that we hear every day at medical school. And I think Rob tells that to us all the times. There are no stupid questions. So just ask away. And if you feel like there's something that you want to do, go ahead, try to approach someone, and don't feel too afraid. And I think just reiterating what everyone else said, joining other societies, doing hobbies and extracurricular activities outside medical school really helps with that. Because when you're just sitting in front of a book 24/7 studying, I think that's what people think medical students do, but that is really not what we do. Because if we do that, I think we'd all have gone mad. So it's very important to kind of give yourself that time off, to get yourself going, keep yourself pushing, and get that extra motivation to actually study when you're studying, and give yourself breaks when it's required.
I think, thank you, Nitya. That's really important. I think as people may have recognised, this whole concept of burnout of practitioners within the medical profession, it's quite a big thing. And I think that, you know, the profession and the school are very keen to try and make sure that we graduate students who have a good balance. We'd rather have happy students who then become happy doctors and actually give a lot to the profession and look after lots of patients, rather than those that, you know, burn out and can't stay on in the profession for some reason. So there's a really good and positive from, you know, individuals' perspectives, but also patient care perspective, to actually concentrate on that quite a lot. Other question? Yeah, go on, Michael.
No, just to, partly a comment and partly kind of a continuation of what's been said. I think one of the reasons I think it's really important that we're a friendly place, because being a medical student is a fairly stressful existence. You've always got some deadline coming up and some exam or some assessment or whatever, and it's really, really important to be able to talk to other people about it and to feel that you can. In my just observing Dundee medical students, bringing out the points that Nitya and Dom were making, I think it's because of the way we select students, the interviews. We select people who are very good at communicating, who are very personable, who are intellectually curious, who are open-minded, who are basically just good communicators. So, you know, I think it's a very pleasant environment to work in as a teacher, that's for sure.
So students who are on the call, do you realise he's talking about you lot now? So, there we go. John, you've joined us. Hello.
Hi, I was just going to say thank you everybody again for coming along, and just to pick up a point that was in the questions that Michael touched on. The thing about Dundee is we will always look at your application in context. We'll always look to see, you know, why you have performed the way you are, and if you're really good in really difficult circumstances, we will take that into account. So I guess one of our claims to fame is that we are fair, and we're looking for really balanced students who are really good, regardless of which element of the profession they go on to studies. And to pick up on one of the things I replied to in the questions, you know, somebody said, should I apply with these grades, should I apply with that? The one way you're guaranteed not to get into Dundee is if you don't apply. So if you are close to the levels that Michael said, or exceed them ideally, then you should really think about applying to Dundee. That would be my simple message. I jokingly say to the students, you have to be in it to win it. And, you know, it is a great medical school. There's nothing more I can add.
Sophie, did you want to? Thank you, John. Sorry. Did you want to add something there, Sophie? Or were you just playing with your hair?
I was just moving my hair out of my face.
I apologise. Fiona, go on, come in.
Yeah, so I was just going to build on what John was saying there, and I think I came to a lot of these medical school open days and I just got all in my head about it. I was like, there's no way I'm going to get in. So few people get in. It's not worth applying. I applied for hairdressing at college instead. That was my backup. And actually, it's the best decision I've ever made. I got in. I'm loving it. I'm less than a year, I'll be a doctor. So if you've come along to this and you're sort of thinking, oh, should I, shouldn't I would just say do it, because, yeah, otherwise my life could have been very different. But I'm quite happy with how it's turned out so far.
Excellent. That's nice. Nice to hear. I'm sure hairdressing would have been great fun too. So,
I'm sure it would have been good chat.
I'm sure it would. In fact, it's not that different, I think, sometimes. So, Michael, there's a question there just about, can you just clarify for interview for medicine for 22-23, would it be online and it would be panel or MMI? And I think it is going to be online this year, isn't it? And
it is indeed, and I'm just literally publishing a reply to that. So in this coming academic year, we and quite a few other schools are retaining the remote format, not because we want to, but just really because we can't predict subsequent waves of COVID, and it's much harder to do this if we haven't planned to. So our desire, though, would be to return to face-to-face interviews in due course. So that's our aspiration, and hopefully we'll be able to realise it in the year after this.
Excellent. Thanks very much. Now, if other people can have a think about whether there are other questions that we need to address here. Whilst we're thinking, I want to ask Michael, why were there only 9 categories in your deciles? And why is it not called non-aisles?
It's funny you should say that. I was having a quick look through my slides this afternoon, and I noticed that too. I don't know is the answer.
Dominic does. Anyway, we probably shouldn't get distracted on this, but Dominic, tell us.
It's because of the way bell curves work. You can never be at the very far extreme. It's like statistically impossible. So it excludes the outer boundary, so you end up with just a 90 in the middle.
Well, how about, thank you very much. I've learned something. So it's excluding the extremities, and they count as the 10th category, as it were. Right, thank you. Right, I'm noticing the time. It's 7 minutes to. In theory, we should have stopped at 10 to. So we've run a little bit over. Do we have anything else that we're desperate to answer just now, or shall we call it a day there? Shall we thank the people for joining us? Michael's nodding, so I'm going to take that as a yes. Finley, you're our manager in terms of letting us go live. So just want to say thank you. If you're going to apply to Dundee Medical School, then we'd love to meet you. And if you do end up here, I hope you have a fantastic and a great time. I think we should wave and say goodbye and say thank you for all coming along, and good luck, everybody.
Yeah,
see you again.
This feels like University Challenge now.
It does, doesn't it? Thanks everyone for joining us.
Okay, thank you.
We'll see you sometime.